My name is Jinhua Chen. My topic is how is big data changing healthcare? I am interested in this topic because I want to do some bioinformatic jobs in the future, and I think there is still huge potential development for big data in healthcare field. First, I will talk about what big data is. In general, big data means extremely large data sets that may be analyzed computationally to review patterns, trends, and associations, especially relating to human behavior and interaction. In healthcare field, based on healthcare IT news, big data is a term used for massive amount of information that can be interpreted by analytics to provide an overview of trends or patterns. Organizations leverage big data by gathering records and information captured and then interpreting it with analytics. Big data is being used more and more in modern society. Big data have global influence in healthcare field. One of the most promising examples of big data in global health may emerge from India's ambitious personal identification programming. Since 2010, the government of India has been issuing Aadhaar cards and unique identifying number to all 1.2 billion of its citizens. The cards, numbers, and associated biometric and monitoring health and social data, including electronic medical records and information on health insurance for low-income families on a huge scale, even if limited in its current reach. The Aadhaar system forms a backbone that could allow the more reliable and extensive collection of health statistics. This in terms could lead to dramatic improvements in the programming and delivery of public health interventions. So the use of big data in low and middle income countries is particularly complex. It also offers a greatest potential rewards. Most such countries have vertical programs for the control of human immunodeficiency virus, tuberculosis, malaria, and other infections. These programs have detailed information requirements that needs to be met by community health workers. Community health workers can use mobile phones, tablets, and computers for research and patient care. These slides are examples of how problems can be tackled by big data analytics. Although big data is very useful in healthcare field, there are still many challenges in using big data. At first, data in hospitals are often segmented or siloed. This data is used to carry out the business side of healthcare, but generally not used to inform patient care or treatment protocols. Second significant challenge in leveraging healthcare's big data is to its fullest extent is protecting the patient's privacy. Patient data may be shared after the identifications, but protecting the patient from either direct or indirect identification. Big data is also part of data science. Data science is more than statistics or computer science applied in a specific subject domain. Data knows that a key aspect of data science, in particular, what distinguishes it from statistics is an understanding of data, its varying types, and how to manipulate and leverage it. Because I'm interested in doing some bioinformatics jobs. So next, also going to introduce what do biomedical and health informaticians working in analytics and big data need to know. First, programming, especially with data-oriented tools such as SQL and statistic programming language. Second, statistics, working knowledge to apply tools and techniques. Domain knowledge, depending on one's area of work, bioscience or healthcare. Last, communication, being able to understand needs of people and organizations, articulate results. In conclusion, the growing quantity of clinical and research data, along with methods to analyze and put it to use, can lead to improved personal health, healthcare delivery, and big data can influence the development of healthcare system. It brings lots of changes and benefits in healthcare field, but there are still many challenges in applying big data in healthcare field.